What is, if any, the association between microbiome and a lipid profile?
Yeah, so that's a good question, actually. So the microbiome is plays an important role in what your lipid or cholesterol metabolism looks like, and we're actually starting to see this connection in a study we're doing right now on leaky gut, which I've mentioned a few times. We're doing this study, and we're looking at the impact on cholesterol levels within the body, and using the spores, for example. But the microbiome in general is important for breaking down lipids, and breaking them down into omega-3 and omega-6 type of fatty acids. They're actually called microbial lipids. So, a lot of people, of course, like to take fish oils and krill oils to get their omega-3 and omega-6s, but bacteria make up some of those similar types of omega fatty acids from other fats that you consume. So healthy fats, when you consume, are converted to healthy type of cholesterol or healthy types of fatty acids, and then are used to are absorbed into your body. So what you'll find is a healthy microbiome can reduce your overall cholesterol levels, or sometimes an infection in the gut can actually be a cause of high cholesterol, chronic high cholesterol as well. So if you have chronic high HDL, like unusually high HDL, which people call the good cholesterol, or chronic high total triglycerides, that could actually be a response to infection in the gut. Oftentimes there's certain types of bacteria that cause a lot of inflammation, and that inflammation is trying to be repaired by cholesterol. Your body uses fat as a way of quenching, killing bacteria and removing them. So it'll produce a lot of cholesterol to try to affect the infection. So if, I always tell people, like, to me, high cholesterol levels in the blood is a non-issue unless you have other comorbidities. Nowadays, the Lipitor type of pharmaceuticals are trying to get people to take their drugs at a lower and lower age and at lower threshold of cholesterols. But cholesterol is only an issue if you have other comorbidities like diabetes, you're a smoker, obesity, history of cardiovascular disease, so on. So, but the microbiome does influence cholesterol.
Yeah. We've been trying to drill home the whole cholesterol is not evil thing for many years. I think it's starting to finally get some traction. Amber asks, is that why my HDL and cholesterol is off the charts? And it could, or I guess it could be an infection. It could be thyroid related. There's a million different reasons why it could be. But yeah, any kind of infection would tend to raise cholesterol, right?
Yeah. Any kind of chronic, especially chronic infections. Chronic infections in the gut seem to increase cholesterol levels as well. HDL cholesterol, they always look at HDL and they say, oh, it's good cholesterol. So if you have very high HDL, that's not such a bad thing. Well, it does indicate that there's something going on in the body, especially if you have other symptoms associated with it, like GI symptoms. If you have GI symptoms and high HDL, there's a good chance you've got some sort of chronic infection going on in the gut, whether it be viral, bacterial, maybe even yeast. So it's always good to look at using natural antimicrobials or natural viral, like loricidin is a great natural antiviral product that works quite well. I've used it myself. And HDL, is also increased by things like a lot of exercise. So you think about, well, why does HDL increase with exercise? If you go to a regular allopathic doctor and they see your HDL, LDL levels are off, they'll say, well, you need to exercise more to increase your HDL. Well, the reason why exercise increases HDL is because exercise leads to tissue damage. And tissue damage, when it's repaired, your body makes HDL to try to repair the tissue. So that's why your HDL levels go up. Same thing happens in an infection. You get tissue damage. So your HDL can be up for that reason. So it's not, you don't need to be alarmed by it. It's not going to cause heart disease. You don't have to look at your HDL panel and say, oh my God, I'm going to get heart disease or stroke from this. It's just a clue that there may be something else going on. And,
it's not a deficiency in Lipitor or Crestor or some other statin drug.
Right? Yeah, that's definitely the case. Yes, it's not oh no, I need to start my Lipitor right away. You know, I mean, and
Right,
they're
exactly.
lowering the standards. I mean, they're trying to get. I think the latest. I just heard this at a conference. The latest recommendations is starting kids as early
Yeah.
as 12, 13 years old
Yep.
on
It's great.
statins. It's insane. And statins, mind you, the two things people don't know about statins yet, and the studies are out there. Number one, 10% of people that start on statins end up getting type 2 diabetes.
Yeah.
That's a side effect of statins. Number two, and this just came out about a year and a half ago, statins actually interfere with the recycling and functioning of vitamin K2, which
Huh.
is interesting, which means that statins actually cause calcification. So statins, the number one drug used to prevent heart disease, is causing
Heart disease.
calcification and heart disease. Yeah.
Not so
So
good for your heart.
not so good for your heart. So, and you just look at the epidemiology of it, right? And it blows your mind. The statin use data is just going, it's just going up and up and up. Statins are still the top 3 drugs in the world and
Hmm.
has been for almost a decade. So the number of people using statins keeps going up and up and up. If statins were anywhere effective in preventing heart disease, you would see either non-increase of cardiovascular disease, or plateauing, or decrease, hopefully. But no, cardiovascular disease continues to
Still
go up and
climbing.
up and up as well. Yeah. So clearly they're not doing a whole lot to prevent cardiovascular disease.
Sure, except for probably shortening people's lives.
Yeah, and increasing the prescription for metformin and
Yep.
other diabetes drugs, and improving the number of patients who have to undergo dialysis, and it's
Not to
merry-go-round.
mention, I forget what study it was that showed, particularly in women with higher cholesterol, actually have longer lives. What that was that the
Yeah,
I forget which study that was.
yeah, I know exactly what you're talking about. It's true, and
Yeah.
and there's some people with cholesterol levels, triglyceride levels over 300 from when they were a kid. From
Right.
4, 5, 6 years old, and especially LDL cholesterol gets a really bad name because LDL is termed the bad cholesterol.
Yeah.
But there are like 6 versions of LDL. There's
Mhm.
very low density, mid
Right.
density, and most of the LDL is actually very good for you. It's a carrier of
The
nutrients.
carrier, yeah.
Yeah, and in fact, it's used to plug up damage to arteries and things like that. So high LDL can often indicate somebody that's actually got really good nutrient transport systems.
Mhm.